Well, let's talk to Councillor Darren Rodwell, who's Deputy Chair of London Councils and leader of Barking and Dagenham Council, and he joins us now. Good morning to you. Darren Rodwell, are you there? I don't know if you're
Good
on mute.
morning.
Hello, good morning to you. Thank you very
I
much
am
indeed
here.
for joining us. The London Mayor, Sadiq Khan, has been calling for this. Of course, he also called for that 10 p.m. curfew that we had, for which there was no evidence, as admitted by the likes of Whitty and Vallance. There was never actually been any evidence for that. And then a few weeks later, after all the damage was done, Sadiq Khan was saying, oh, no, we shouldn't have the 10 p.m. curfew. We should stop that. How soon before people like you and Sadiq Khan say, no, we shouldn't be in tier 3 after all those hospitality jobs are gone?
Well, what we're saying is we need to make sure we keep people as safe as possible. Now, Sadiq can talk for himself. I'm talking for a borough that has serious economic issues. And then that was before coronavirus. We were the poorest borough in London, the ninth most poorest area in the country. And the fact of the matter is, we have seen how economically it can damage. But the government should make sure that the financial package needed to support the most vulnerable is there. I've had the highest death rate in the last 3 consecutive weeks, just in my borough alone. And that's not sustainable. Our job is to try and keep people safe. And we know that tier 3 will cause financial hardship. That's why we've asked on the government to make sure that the financial package is there. But I accept there's a lot of confusion around what tiers are in and when it's going to be relaxed. So I would ask the government to carry on supporting hospitality and the culture industries. I would ask the government to make sure that we do have the right support mechanisms in place so the poorest in our society don't have to carry on working, because there's evidence where they're not actually self-isolating because they can't afford to. So it's how we build this together, because lives are much more important than jobs.
Lives are more important than livelihoods, except where the loss of livelihood ends up leading to the loss of life. Now, you said we need to make sure we keep people as safe as possible. I would dispute that that's your job. I think whoever elected you, you're a Labour councillor, you're leader of Barking and Dagenham Council, I think they elected you in the same way that I vote in local elections for people to empty my bins and to provide a library service and to clean the streets. I don't elect you to keep me or my family safe. That's not your job. You've got no remit for that. And yet these demands we've seen. Look, we all know we need more financial help for the businesses that are forced to close, people who can't afford to go on self-isolation. I was talking about that back in February, for goodness sake, even before we actually were seeing even prospects of lockdowns, making sure I'm talking to. I remember questioning Matt Hancock about it at the time, saying there's no way you can expect people to self-isolate if they're not even unwell and not be paid to do so. But the reality is, most of these people, they don't want to have to self-isolate when they haven't actually got a disease, which most of them haven't. They don't want to have to close down their businesses and take charity from government. They want to be able to run their businesses, have customers and be out and about. Given that there is no evidence that closing hospitality makes any difference, plenty of countries across Europe have closed their hospitality for a month on end. They're still seeing rising cases. It's winter. It's a respiratory disease. It's going to go up in winter. Why is anyone surprised by this? Closing down hospitality doesn't actually save any lives. So why do you support it?
As I said before, right, we look at the evidence that's been put forward to us by Public Health England, and actually you are wrong. I do have a duty. Yes, I do have a duty, a legal duty to keep people safe. I can actually go to prison on some cases as the leader of the council if we do the wrong thing by people. So actually, I take my job really seriously. I do find it very disheartening when you think about what men and women are doing to try and keep our communities safe. We've got the biggest mass test rollout. We tested 1,000 children yesterday because we know there's issues in schools and how we can support them. And schools have been a safer place than the supermarkets or the malls and places like that. So it's about trying to make sure that we support the whole community in the best way we can. And whilst I understand that there are concerns with business, and like you, we've been asking government to make sure that the right support packages are in place, because we don't want anyone losing their jobs. We don't want business to fall over.
No. So you can want whatever you want. They will lose
Absolutely,
their
they will.
jobs.
But
Businesses will go under
yeah,
and
there will.
jobs will be lost. So wanting anything, that's just pie in the sky nonsense. You
And
support a policy that will absolutely
well,
categorically
again,
cause
the greatest.
people to lose jobs in what you say is the poorest borough in London that you represent and you've got a duty of care towards, and you support a policy that is going to put your people out of work.
I support people living. Yes, and as I said to you before, right, the last 3 weeks we've had more people die in this borough from coronavirus than we had previously.
And is there any evidence they'd been in hospitality venues in that time?
Well, sorry, whilst the public health, uh, is saying to us as leaders, you must take more action on this. And remember, we are guided by the professionals. You're not a professional in public health, nor am I. So we'll take that guidance.
Can you tell me the evidence you were given? Because I do talk to an awful lot of professionals.
I can't tell you the evidence because it's in private meetings that we had on Saturday and Sunday.
Hold on.
Spend a lot of time working this through. We don't take these decisions lightly, neither national government, regional government, or local government. What we're trying to do is work together. We have said to government what we need: support the most vulnerable and to support the businesses.
You've said that. You're sorry. When there is a measure to shut down our society, to kill off jobs, which does lead to loss of life. We know that is 100%. That has a knock-on effect. And goodness me, the Labour Party's been talking about that since 2010, haven't they? There's no doubt at all about that. I believe that we should know what the evidence is. I have looked at all of the evidence. I've spoken to numerous experts, spoken to people on Sage, independent Sage, experts, cabinet ministers and the like, every single day for the last 10 months. No one has presented me with any evidence that hospitality venues are where people are getting this virus. So what evidence were you presented with that means that you support a policy that will put the people of your borough out of work?
Well, all I can say to you is there was meetings at the weekend. We had been advised that we need to take action to take.
What evidence did they show? You said they showed you evidence. Was it a big scary graph? Did it look really scary?
I can't tell you evidence that we're being given privately by government health officials.
Why not?
To tell us to make decisions.
Why not?
Because I have a trust that we have with working with government, and that trust is saying to us, the trust is that we do not declare what's being said in those meetings.
Let me just clarify. Darren, let me just clarify. You think that it's reasonable that the public should have massive restrictions on their freedoms and on their lives, and that businesses should be closed down, but we have no right as voters in a democracy to know what the evidence is for those rules to be imposed on us? You genuinely think that's acceptable in Britain in 2020?
The evidence is out there by Public Health England. The evidence is out there. It comes out on a daily basis. They keep coming up with new evidence, like the new strain that was mentioned yesterday, which we're being talked about. The evidence is there. We have to take the best decision. So we are supporting the government, both nationally and regionally, in the idea of tier 3. But we are asking that we make sure that there is a support package in there to help hospitality, to help culture sections and business in general, as well as supporting the most vulnerable. And that is what we've got to do. Now, I believe that people will understand that because we are seeing people dying. Family members are being lost. I don't want to see that in my borough. I don't want to see it across London.
But you will see it. You will see it because we have an endemic virus that particularly kills people over the age of 70. And your part of London was not very badly hit during the first wave, and therefore very tragically and sadly is going to be badly hit this way. But we are, do we shut down society whenever we have a bad flu epidemic? No, we don't. I'm really intrigued to know what evidence. I've looked at all the publicly available evidence on Public Health England's website, in the NHS websites, all the data, the REACT study, the Zoe study, everything. There is nothing to justify tier 3 lockdown in London. Not a single thing. And there are plenty of experts saying that, Darren.
Well, then that's fine by them. I can only tell you what we've been shown. We were advised by Public Health England, by the
experts.
by our experts
Your
who said
experts, yeah.
this needs to happen. There was a massive increase. It's government experts who have told us, that this is what needs to happen to keep people safe.
Yeah.
I would much rather have this disagreement with you in this position and making sure that I'm doing everything I can to put people first. And that's what we do. And that's what the choices we have to make.
Okay.
And whilst it may not be popular with some people, I can assure you it's popular with other people that are very worried about their families.
I think we've just got to the nub of the issue. Popular. Because if the media tells everybody that this is what we need to do, and then politicians say, well, yes, this is what we need to do, you don't want to be seen to doing something popular. It doesn't matter whether it works or not. In a few weeks' time, when this has no effect on whether or not people die from this virus because it's not being transmitted in hospitality, will you come back on the show and talk about it?
Listen, I will justify why I have decided with other leaders, to do what we have been told is right.
All right. Well, look, we'll talk in a few weeks' time, Darren. We'll talk in a few weeks' time, if you would, and we'll talk about whether or not this has succeeded. Darren Rodwell, leader of Barking and Dagenham Council.